Hi, this is Martin Lamner with VeroBeachFlorida.com, and we are here as part of our new video series on pets that the Blue Ribbon Charitable Foundation has been able to assist with medical care through their Pet Medical Assistance Program, Pmap. And one of our doctors here today at the Florida Veterinary League is Dr. Kim Wilson. Welcome.
Thank you very much.
Yeah, see right in the camera there. Now, tell us a little bit about what we're going to be doing with our little pet here, DuPont.
Yeah, this is DuPont, and he has chronic back problems, chronic disc problems in his back. So sometimes he has trouble walking, he can be very weak. And so I treat him with acupuncture, and that just involves putting special needles, very small needles, into various places to help him with pain and also improve the neural conduction.
Now, these are pretty small. They're almost not even needles.
Oh, they're tiny, yeah. If you take a look at these, the length sometimes can be a little scary. So here's this. I don't think you could be able to see that on camera. They're so tiny. The length that's an inch long needle, but it's so fine that you don't really even feel it going in.
And people don't understand, they're not sticking it in the whole inch.
Oh yeah.
It's just, oh, you do sometimes?
Oh yeah, absolutely.
Oh really?
Yeah.
Oh, okay. They're sticking it in a whole inch. But I've had acupuncture before, I think a lot of people have, and we know the benefits of it. But in this case, the benefits are so tremendous that he was having a hard time walking.
Yeah, he was actually dragging his left hind leg when I first saw him, and had been for quite a while. And DuPont is just an amazing dog. And he's especially amazing because of the way he responds to acupuncture. We've seen him sometimes coming in just terrible pain and barely able to walk, and after an acupuncture treatment he gets up and walks his way out of here.
Now he's in today for another treatment, and why is that? How come like one treatment doesn't last the rest of their lives?
Yeah, wouldn't that be nice?
It would be.
I don't know anything that lasts the rest of our lives. With acupuncture, sometimes I do a treatment every week, sometimes a couple times a week. Other dogs, after we've been getting a response, I can space that out to once a month, sometimes even a couple of months apart. And with DuPont, we've been able to do that. And then sometimes he has a little flare-up, and so we do him a little more frequently. And recently he had a flare-up, so we're doing closer to once a week right now.
So now what you're going to do is do an assessment, do an exam on him, and you place the needles, and I'm going to step out of the way so you can work, and just talk us through how you know where you put the needles, and the whole chi.
The whole chi thing.
The whole chi
So that
thing.
isn't like a 10-hour lecture.
Okay, we only have 10 minutes.
Yeah, okay. So when I start, I like to place a couple of calming points. There's some calming points here around the head. And you can do the same thing in people. A lot of these points are the same points that we would use in people. So that's what I'm going to do first. And this just puts a needle in, and DuPont is just a wonderful patient. He likes his acupuncture. Okay, so that's one of the main calming points there, and that's usually the one that I use on DuPont. Other dogs that are a little more anxious, I'll put in additional points. The placement of the points, I do it based on, in fact I need to do this, I do it based on a pattern that I see, based on his pulses, and also my general exam, and also what I'm being told by his parents. So right now I'm checking his pulses, and I'm looking for, are they weak, are they strong, superficial, is the right stronger than the left? Okay. So his pulses are a little bit weaker on the right, and mildly weak on both sides. So he's got a deficiency, and like a kidney qi deficiency is what would make sense, and based on his history. So now the points that I place will be in part in certain channels or meridians. You never do that. And then also local points to take care of, he has certain points in his back that tend to be painful. And so we'll treat those as local points.
Dr. Wilson, he has been doing more shaking in the rear.
Okay. Thanks for telling me. Splint in here. You're doing good, huh? You're doing good.
Typically, how many needles would you use in a treatment?
It really varies widely depending on what I'm treating. So, for example, I've treated a dog for a chronic cough that had lung qi deficiency, and with that, I think I used 4 needles. With a back problem like what DuPont has, I'm treating local points as well as the, sorry, apparently I can't talk and place needles at the same time. So I'm placing local points as well as some points in the different meridians, so it tends to be more points. So I'm placing about 4 different points for the meridians, and then a larger number of points for the local effect. So with him, when I'm doing dogs with back problems, it tends to be more needles than with some other problems. So if I were treating for, say, a hormonal problem, like, say, Cushing's disease, there's a number of different Chinese presentations for that, but I might use 6 needles. Whereas this tends to be more because I'm also placing for local relief of pain. You're really sensitive. Has he been, so he's been shaking more?
Yes.
He's been getting around okay?
Yes, he has. He has, his rear legs have come out in a Y, and he's gone down to the ground a couple times.
Oh, wow, okay.
But overall, he has been doing very well.
Okay. He's just more sensitive than usual. I don't know if it's the too much attention or something like that.
The weather also seems to make him more to where he doesn't want to even use the stairs to get up onto the couch. Really? He'll lay on the floor instead of...
Okay, so his back is bothering him.
Mm-hmm.
His walks have been good. He's really been wanting to walk.
Okay, that's good.
But
he doesn't want to jump up.
Right,
Okay.
and we've noticed with him doing his business, lifting his leg, he's
Having
not...
trouble with that?
Right,
Okay.
it's only coming a couple inches off the ground and it's not
Okay.
staying up the whole time.
I forget, which leg does he usually lift?
He's an equal opportunity lifter.
Okay.
He starts with one and then spins around and finishes with the other.
Right. Does he okay? Yeah, beautiful.
And I noticed even standing there on the table, his paw at one point got turned and he wasn't
The
turning
left
it back.
left back?
It was that one,
Really? Okay.
just for a moment, and then he put it back.
You're doing good though.
Yes,
Yeah.
it was his left back.
Left hand? Yeah. That's the one that's usually the problem.
When he struggles, we give him a little extra downtime
Okay, that's good.
in the cage, which he doesn't mind.
Okay, that's good. So some of these points, all these points that we're seeing across here are local points. So that means trying to take care of pain in those sites. But then some of these other points that I put in, this one here and this one here are for different meridians or channels of chi or energy. One that I'm putting down here is very nice for pain. Making quite a mess here.
Dr. Wilson is very impressive and does an excellent job.
You're being supportive. All right, now I'm gonna hook up, do some electroacupuncture. Sometimes this can make it more effective, the treatment more effective. And DuPont responds really well to the electroacupuncture. So it sends a light current through here. If anybody's had a TENS unit, it's sort of similar to that and feels about the same, I think. What was here that they thought was big? Hang in, bud. Once we get those in, we'll move into it, okay? So I just hook these little clips onto here, and then once I turn it on, it'll send a little current through.
So the lights won't dim.
Yeah.
once you turn it on.
Only if I really turn it up. We have a generator outside just in case.
Are most dogs this calm when you're doing acupuncture?
Most dogs do really well, but no, not everybody's as calm as DuPont. DuPont really seems to enjoy his acupuncture. A lot of times he'll almost doze off. So I have a few dogs that really are very calm about it. I had one dog roll over on his back and go to sleep. Some dogs are more anxious, definitely. It always helps to have their owners or parents here because that usually makes them less anxious. Okay, so you want to make sure that here. Okay, so now I'm just turning this on, and I'm going to do the one that works really nicely for pain, since it seems like with his not wanting to jump up, that he's probably experiencing some pain in his back. Okay, and this is just to kind of look for a response and adjust it. Yep. And then I give it a few seconds, and then I may increase it a little bit just to see how he does. Oops, there we go. Yeah, you doing good? You're good. Don't step on your wires though.
He's ready to sit.
Yeah, so he can sit at this point. He can relax. You want to relax, hon?
If you remember from last time, when he sits, he likes to lean into you.
Yeah. Ron's here. Ron's good. Ron's been with DuPont before. Okay. There you go, bud. You're doing good. You are. Okay, so I'm happy. And so now he's gonna basically sit and cook for about 10, 12 minutes. I don't mean cook for literally. No cooking literally. And then I'll come back and we'll remove the needles. As I say, usually he's sometimes he'll close his eyes halfway and be taking a snooze. So that's the placement of the needles, and we're ready to go.